Hi, everyone, and welcome. My name is Stefan Wheat, and I'm a clinical fellow with the Global Consortium on Climate and Health Education. And I'm pleased to help moderate the second clinical case skills session for the Caribbean Climate and Health Responders course. As a reminder, CME credits are available for this session. You can copy the link at the bottom of this slide or capture the QR code here to the right to get credit for learning from this session. Today, we'll be presenting a clinical case with associated clinical pearls and a brief discussion at the end. And the case today will be related to climate change and health. We have some phenomenal actors who will be playing both the clinician and the patient today. And with that, I'll launch right into our clinical vignette. Today, we'll be meeting Michael, who is a 25-year-old man who has worked in the shipping industry for 5 years. He works in a warehouse near the Port of Spain in Trinidad and Tobago. He lives nearby, and the recent unprecedented severe storm with resultant flooding destroyed his home where he, his wife, and their 3 children lived. The warehouse where he works was also largely destroyed, and several of his coworkers and friends were injured during the storm. Additionally, the warehouse where he works has been flooded, and he has been wading through floodwaters for the past week at work, helping to clean up. He is in the clinic today because he doesn't feel like himself. He's had less energy, is sleeping less, but is also experiencing new joint pains. His wife noticed that he had a fever and told him that he needed to go see the doctor. He also knows several other friends in the community who are experiencing similar symptoms. And for our clinical setting, we'll be in a public hospital in a semi-rural area. And for our tone demeanor, Michael is friendly but somewhat withdrawn, and he does not have much experience with medical providers. For our physical simulation, Michael is slow to respond and he is somewhat yellow. And with that, I'll pass it on to our actors.
Hi, Mr. Michael. I'm Dr. Lachman. Pleased to meet you. What brings you to the emergency room today?
Hi, doctor. Well, my wife insisted that I come in today because I haven't been acting like myself. And well, I think she noticed that I have a fever. She told me that I look, yellowish, pale in complexion, but I don't know.
I'm so sorry to hear that, Mr. Michael. Can you tell me a little bit more about the symptoms you've been having?
Well, I haven't been sleeping very well since the storm, and I don't have much of an appetite. And my wife worries that I'm drinking too much. But a lot has been going on, because of the flood and stuff like that. My wife also took my temperature, and it was 39 degrees. And I'm not sure if that's high or low, but she worries. Apart from that, I have some nausea and joint pain. But I'm not the only one feeling ill, Probably it's just another virus going around.
It sounds like you have a lot going on. When did you notice something was off?
Well, I haven't really been sleeping since the storm 2 weeks ago, but the joint pain and nausea just started a couple days ago.
And has this ever happened before?
No, that's what I find it so strange, I'm typically a really healthy person.
Which joints are hurting you?
All of my joints seem to hurt. My knees, my ankles, my hands.
And does it seem to hurt like all the time, or is it a particular time of the day?
Well, I think it hurts every day. I think it hurts constantly all the time. There isn't any swelling or anything, but just constant pain.
Can you describe this joint pain for me a little more?
Well, my joints, they ache all the time, and I feel nauseous and extremely tired, so like way more than usual. But before that started, I just wasn't feeling like myself. I wasn't feeling well. I was more jumpy and less able to relax and not able to sleep at all. And normally that's not a problem for me.
Right. And have you done anything that makes it better or worse, like take any medication or anything like that?
Well, the only thing I could think of is, I've just been drinking a bit more than usual. that helps me. That usually does the trick. Not being able to sleep has made everything worse for me. So drinking is my only way to cope right now.
Right. Any other symptoms like dark urine, pale stool, you're feeling more thirsty than usual?
I think, yeah, my urine has been darker actually, and my belly hurts a little, but yeah, I think that's just to the extent of it, if I could recall. I don't think anything else.
And how about your family at home or your friends at work? Anybody have similar symptoms?
Surprisingly, no. My family, they are fine. They don't have any similar symptoms as myself, but I do recall that some persons from work, my colleagues, they are a little sick as well.
All right. And you have any medical or surgical problems?
No, not to my knowing. I'm normally never sick, pretty healthy.
Mhm. Any surgeries before?
Um, I think in 2015, I believe so, yeah. I had my appendix removed, yeah, a few years ago in 2015. I had my appendix removed.
In 2015.
Yeah.
Who do you live with at home? Tell me a little bit about home.
Well, I live with my wife and 3 children. Um, right now we're basically situated at a emergency shelter. Because of the storm and the great flooding, we are not able to stay in our home anymore. Our home is uninhabitable, and we lost all of our furniture, all of our clothes. So, we are living in a shelter with a lot of persons who would have experienced the same thing as us. And there isn't any clean water, there isn't any proper sanitation. Everyone is basically cooped up in a small area, in very close proximity. And I don't feel comfortable, because I have 3 young children and a wife as well.
I'm really sorry to hear that, Mr. Michael. Sounds like you have a lot going through. How else this flood affected your family though?
Well, for me in particular, I haven't been able to sleep, and I keep having nightmares and flashbacks about the flood. I'm just struggling to come to terms with everything that happened. Not only me, but my family as well. I know my kids, they find it hard to not have and live the life that they are accustomed to. And that even makes things even more worse to me because it keeps me up at night and it keeps running through my mind.
Right. I understand. I know this increased precipitation and flooding has been affecting everyone. Now, you have any outlets for your stress or you have any additional support at this time?
Um, well, the main thing that I do to help cope with distress is drinking. I drink a bit more than usual. It helps me cope with distress. It keeps my mind at ease. It just makes me feel better. And my family tries to, help me cope, but I don't think it works. Only alcohol is really the only remedy that works for me.
Well, this alcohol, like you ever felt the need to cut down on your alcohol, or if you ever felt angry if somebody criticized you about your alcohol intake?
Right now I don't see any need, and I don't feel a need to cut down. If anything, I think I want to drink more because I it's never ending. I feel overwhelmed every single day, being stressed at work, being stressed at home. So no, and you know, I feel bad sometimes, but what can I say?
And how about feeling guilty about drinking? I mean, you think you feel guilty about drinking, or you don't think?
Yes,
And
I do. I do sometimes, especially because I have kids and I don't want my kids to see me drinking this much and think it's a normal thing.
right. Um, Now, I noticed you said you have been turning to alcohol a little more because of what you've been going through.
Yeah.
You ever had to get up in the morning and the first thing you had to do was take a drink of alcohol before you go to work, or you usually do it after work?
Usually I don't do that because I don't want to be, drunk on work. But like, say for instance, if I had a terrible night before and I just couldn't sleep, I Yeah, I would take a little drink before to go to work, just to, be calm.
Yeah. How about anything else? You ever try anything a little stronger, like cannabis or cocaine or anything like that?
No, doctor, I didn't even smoke. I stopped smoking about 5 years ago, and I have never tried any cannabis or any other illicit drugs.
Right. Okay, Mr. Michael, from what you have told me, it seems as though you have been turning to alcohol a little more to use as a coping mechanism, right? Now, as my responsibility as your physician, um, I need to help you deal with your stressors, right? Now, because from what you have said, I need to ask you a few more questions that's a little bit more sensitive. Now, if it becomes oversensitive and you need to stop, you can stop me at any time. Okay, Mr. Michael? All
Yes,
right.
doctor.
So during the last month, have you ever felt down or like sad or depressed or hopeless or anything like that?
Doctor, I feel sad all the time. I feel hopeless is like a feeling that it never leaves me. I'm not sure if it's called if I go so far as to say I feel depressed, because I'm not sure what that is or what I would look like. But I just feel sad constantly, every day, whole day, all the time.
Hmm. And during the last month, like things you used to do for fun or things you used to do in your spare time, you think you have time to do that? You take pleasure in doing anything like that since then?
No, I don't feel motivated. I don't feel the need to do anything again, because like, number one, I feel ashamed. I feel ashamed that I lost everything. And I know it's not my fault, but I can't help it. And I just don't have any zeal to do anything. I just want to stay home and take a drink. That's the only thing that helped me, just taking a little drink and trying to forget about all my worries.
Hmm. So I'm so sorry to hear that, Mr. Michael. Um, since all this has started, have you ever felt the need to like hurt yourself or hurt anyone else?
No, 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 doctor, never, never, never. I never felt the need to hurt myself or anyone else. Never, never. I just wish my problems would just magically disappear.
Mhm. Okay, Mr. Michael, thank you for sharing that with me. I think you could need a little help with your coping and your coping skills. We'll address that a bit later. Um, but right now, I just have a few questions about your symptoms and we'll get to your examination after, right?
Thanks to you, doctor.
All right. Now, I want you to tell me a little bit more about your situation at work. Now, I know you mentioned you have been working in the floods. Like, tell me what your work entails and if anybody at work had similar experiences as you had.
Well, I work at a warehouse down at the dockyard, a ship warehouse. So it's, I do typical standard cleaning and maintenance at the warehouse. But right next door to the compound there is a area where residents in the area typically dumps garbage. And typically it's surrounded by a lot of dogs, rodents, insects, cats. And because of the flooding and the storm, obviously, the water, it ran into the shipyard. And basically, we are walking around in muckish brown waters that it basically is runoff from the garbage next door. You even see rodents floating around. And the company doesn't provide us workers with any protective equipment to safeguard ourselves. So basically, we are working in a unsanitary environment.
Okay, Mr. Michael. I mean, I'm so sorry that you have to go through that, especially with the flooding and the issues that you're having at work. Um, I know it has been causing you a lot of stress, and I thank you for bearing with me. I mean, all these difficult questions I've been asking you. All right?
Yes, sir.
Okay, Mr. Michael. After speaking with you, there's a few things that I'm concerned about. One being probably an infectious disease that you may have picked up working in the flood. I would like to do an examination on you, if that's okay with you. and we'll discuss after I finish the examination. Is that okay with you, Mr. Michael?
Yes, doc, if I have to, no problem.
Okay. Okay, in terms of the general appearance of Mr. Michael, he's a well-nourished, well-developed 25-year-old. He looked mildly jaundiced and mildly ill and appears anxious and guarded. Now, in terms of his vital signs, he had a fever, 39 degrees Celsius, with a blood pressure of 105, pulse 118, and respiratory rate of 20. Now, other pertinent, well, important negatives in neurological exam was normal, ENT exam normal, and also in terms of the skin and the musculoskeletal exam, remember he had mentioned he had joint pains, but there were, on examination, he had no erythema or swelling or warmth in the joints. The joints were perfectly normal. His cardiovascular system, normal S1, S2, no murmurs. And on his abdomen, however, he had right upper quadrant tenderness and an enlarged liver on examination. There was no rebound or garden at the time of examination. And in terms of his response, he had a delayed response. He was slow to respond with anxious speech. But keeping in mind that he is having a fever, so I mean that could be with respect to the fever as well and his condition at this time. So at this time, I would like to go through the differentials for this case. The presentation, as you can see, would be wide ranged because you have a patient comes in, a 25-year-old who is fit, no previous medical problems, fever, abdominal pain, and he's icteric. Now, keeping in mind with the history, so remember the history tells you that the patient has been exposed to flood waters, he has been dealing with animals as well, rats, dogs, cats, in the floodwater as well, and he has been exposed to the floodwaters without proper protection. Now, normally for this case, if a patient comes with fever, you would have to adhere to all your COVID protocols. So COVID-19, although it is not obvious in the case, would have to be one thing to consider. The history and examination will have to be done with proper PPE, and then you consider the case itself where you have floodwaters with fever, abdominal pain, and icterus. The first thing on your mind should be leptospirosis. One being that it's endemic to the Caribbean area, and two, the other things that you should consider with it is dengue, chikungunya. So these three would go more or less hand in hand, depending on what your blood results show. Now, also in the history, you'll note that he has an alcohol abuse problem. Now, that could also manifest as an alcoholic hepatitis, which we would also have to look for when we're doing our testing. So in terms of medical aspects, you have viral causes, which would be the dengue, the chikungunya, even malaria as well should be considered. And then with respect to the case and the exposure, you have lepto, which would be high on the list because you want to make sure it's not that, and well, the alcohol hepatitis. Now, he also mentioned that he was having trouble to sleep and he was having flashbacks. Now, the flashbacks and the nightmares and the difficulty to sleep could be pointing in the direction of depression as well as PTSD. Because remember, he mentioned that every time the rain falls, that he would get scared, or he keep remembering the flooding history and when he lost his home. Now, these are major triggers that could lead to one, depression, which we can't really diagnose now because it's depression with congruence, because remember, he has a direct trigger and it has been only a month. So he would be depressed, but if it continues for more than 6 months, then we have to consider a diagnosis of major depression. And well, the alcohol, with respect to within the same lines, you have to think about substance abuse. Now, in terms of surgical causes, the only surgery that he had before was appendectomy. Now, obstructive jaundice should still be considered, because this could be a cause of his symptoms as well with the right upper quadrant pain. So you have probably a calculus, cholecystitis, or a cholecystitis with gallstone, which is more unlikely with his age and his gender. And you also have to think about the ascendant cholangitis as well. Now, based on these differentials, we would order or we do testing to refute or confirm our diagnosis. So with all testing, we start basic first. So the basic testing would include a urinalysis, do a ECG, he's tachycardic, let's make sure there's nothing else going on in the heart. You do a chest x-ray, send off first, take a stool for sampling and send off. Simple interventions first. Then we go on to hematological. Now, in terms of hematological, we could start with a basic CBC. What we're looking for in the CBC would be looking at the white blood cell, if you have an elevated white blood cell, and you're looking at the platelet, if he has a low platelet. So a low platelet with an elevated white cell would push you more into looking at if it could be lepto, and the low platelet would also give you an idea if it could be one of the other viral causes such as dengue or chikungunya or the others. Now, in addition, we would want a liver function panel and we would want a renal function panel. The reason for both of these, in addition to the CBC, is with respect to lepto, you want to make sure you want to rule out something called Wheals disease. Now, Wheals disease is treatable, but you need admission and you need to confirm your diagnosis. Lepto in general, if we see in lepto, we could always treat, give the doxycycline and treat one time. If the patient is well and no signs of liver failure or renal function, they usually improve and do well. If they do have liver function, evidence of liver function and renal failure, then we have to make sure it's not Wheals, which can be fatal, right? Now, in addition to this, we could also order PTINR, a clotting profile, ESR, CRP, and then we could go on now to radiological intervention. So if we're in the emergency department, our emergency department has a ultrasound, I could take the ultrasound probe and ultrasound and check the liver and check for free fluid in the emergency department and then organize a formal ultrasound. In addition, I could order chest x-ray and other radiological interventions as needed. One important thing in particular with this case would obviously be lepto, dengue titers. Those two titers and chikungunya titers will have to go off early, and first and foremost, before anything else, before you actually see the patient, before you actually even intervene, would be a COVID-19 test. If not a STAT test, at least a basic PCR, confirm that is PCR negative, and then you could go down the other pathway. Right, so testing and imaging should be straightforward in this case. I mean, there's a lot of other things to consider, but our focus today would be one, the PTSD, the depression, and the presumed diagnosis of lepto. And based on this, I would institute treatment likewise. So if the patient has the upper quadrant pain, fever with the icterus, I would admit to hospital, start empiric therapy. So he has a fever, you give him some Tylenol or paracetamol. You keep him hydrated. He could do oral hydration, that is fine, and you could start IV hydration as well, because he would be behind on fluids. One other recommendation would be you need to take a proper family history as well, because the situation home in this case would be important, because you want to make sure you pick up on the cases that could possibly be at home and the cases that could be at work. So if we're thinking along the lines of lepto, you want to do contact tracing for lepto at home and at work. So your public health professionals will have to be involved early rather than later. The other thing as well is you would, because of the PTSD, you would want to get a psychiatric referral early, so they don't need to come immediately to see him until he's stabilized. But before he leaves the hospital, you would need a proper psychiatric evaluation.
That was a fantastic review. Thank you, Adesh. I'll stop my screen share and let you conclude our case with our patient, Michael.
Hi, Mr. Michael. Thank
Hi,
you for
Doc.
your patience. Yeah, thank you for your patience. I know it has been a long day. I had a chance to look at your lab results that I got back. And from your history and your examination, I think you may have contracted a infectious disease, something called leptospirosis. There are other things that I want to consider, but because of your exposure to the flood and your exposure at home and at work, I would like to rule out leptospirosis. You ever heard about leptospirosis before?
No, I don't know what that is. Is this something? Am I going to die or something, doctor?
No, you wouldn't die from it once we treat it early. But the main thing is to institute treatment early, which is what we're going to do today, right? So you don't need to worry about that. Now, lepto is a bacteria. It's carried mainly, remember, you were dealing with rodents and these dead animals that you're removing, and you weren't protected properly. So you had exposure to the floods, right? It usually is in the urine of these animals. So if you come in contact with it through abrasion or a cut, it could get into your body, right? And cause the symptoms that you've been having. So you know the abdominal pain and the fever and the yellowing that you've been seeing, it could be that's what happened to you, right? But there's nothing to worry about. I'll keep you in
Alright.
hospital today and I'll confirm the diagnosis and I'll treat you early, right? So what I want you to do for me, so I'm gonna keep you in the hospital. I'm gonna start treatment. I'll
I
give you
have
some
to stay,
Panadol.
doctor. I have to
Yeah,
stay.
I think you should stay because remember you have kids at home and you have your wife at
Right.
home. You don't want to carry back anything to them, right? And I mean you want to go back home, you want to go back to work, and you want to go back to work feeling better as well, right?
Okay,
So
doctor.
I say stay today. Let's see about it today, and then you could go home after we confirm everything and start treatment, right? So I'll give you the Tylenol for the fever. I'll start you on some hydration, some IV hydration, and you could drink the water if you like to. The only other thing I will request of you is that I think you should contact your family and your friends at work, find out who else feeling sick and have similar symptoms and let us know, right? So we can treat them as well if we need to. And well, I'll contact the public health department here and inform them about the case. If that is okay with you, right, Mr. Michael?
Yes, doctor.
Right.
Doctor, I have a question. Is the lepto thing the reason why I'm not sleeping as well? I don't know why I'm not able to sleep.
Right. Well, I think this the not sleeping part is another diagnosis that I'm considering, something called PTSD, which is post-traumatic stress disorder. I don't know if you heard about it before, but basically what it means is, remember the flooding and how you lost your home and all these things happening all at once. And remember, you say you had the nightmares and the flashbacks, right? I think like when you go to sleep, I sure when the rain fall, you get worried and you're up and you're vigilant, you want to know what's going on. I sure that is what happened to you. Now that could be PTSD. That's the trauma from this flooding happening and all that you had to deal with within the last few days, manifesting as the nightmares and the flashbacks. Right now, what I would do for you from that, all you need is really some way to deal with the stress. Right? So the alcohol that you were using, that's what you know. You use the alcohol and you're thinking the alcohol could deal with the stress. But I'll pass you on to a psychiatrist who would teach you some coping strategies, and if need, they may put you on some medication as well, right? And if you need, I could also get the social worker involved. So I know you lost your home. So in terms of the financial burden for you will be high right now, I understand. If you need any help along that line, I'll get the social worker involved as well, so we can get some assistance for you, right?
Thank you, doctor.
All right. So again, Mr. Michael, thank you so much. Thank you for understanding and being forward with me. And I assure you, once you stay in hospital today and we start treatment, you should be fine. Right? If anything come up, if there's any other questions about home, about family, about work, you just ask us and we'll try and help you out, right?
Thank you, doctor.
All right. Do you have any other further questions?
No other questions, Doctor.
All right. If not, thank you, Mr. Michael. I'll go and organize now to get you admitted.
Great, thank you, Adesh. The next thing we'd like to consider here is some of the clinical pearls from the case, what everyone who is listening in and who is learning from this case can learn and take home and implement in their own clinical practice.
Right. So good. So as you can see from the case, we had a patient who presented as any normal patient on any given day. Fever is one of the most common presentations. Now, as you can clearly see from the case, taking a proper environmental history is very important, because missing a diagnosis of lepto can lead to death, and it can be fatal, and it's easily treated once you pick up on it. It's just to run a test and start the doxycycline. Now, the other thing that you may not have picked up early in the case is that from natural disasters and flooding and hurricanes carry with it a psychological aspect. So you have persons who, well, say you lose your home, you lose everything that you worked for your entire life, you lose your family, you lose your loved ones. This can have a direct effect on a person, on a patient. And in our case, it was PTSD, but it could be depression, it could be suicidal, it could be a lot of other things that you have to be a little tactful and to pick it up in the history, right? So you need to be attentive to the psychiatric part of your history in all cases. And once you encounter it, so you see within our case, we spoke to Mr. Michael. Mr. Michael had immense challenges. And one of them, as you could say, was as the flashback and the nightmares. Now, if you just focused on the medical aspect of the case, you would totally miss the psychiatric part. And when you're dealing with it, you deal with depression. If you deal with depression, you do a little scan to make sure the patient are depressed. If they're depressed, they just do a scan and make sure that they're not suicidal. Because if they're suicidal, they wouldn't come forward and tell you, hey, I'm not feeling well or depressed. I'm thinking about hurting myself. No patient will actually come out and tell you that just like that. Sometimes you need to be a little tactful in your history taken and your examination. You look at the patient, check the demeanor, you look at the effect to make sure that you're not missing anything. And especially with flooding and natural disasters is one thing that we should pay attention to. Now, as I said before, this could happen with any extreme event. In this case was flooding, it could be a hurricane, it could be an earthquake, it could be anything else. It applies across the board to all natural disasters. Now, with respect to the lepto in particular, doxycycline prophylaxis is the most important thing that you could do for this patient. Once you initiate treatment, you could confirm your diagnosis after. If your diagnosis wrong, say it's not lepto, it's dengue or chikungunya or even obstructive jaundice, the doxy will still work and the doxy will still start the treatment for the patient. So in terms of patient outcome, you actually already started treatment and you prevent adverse outcome from the beginning by just doing the simple measure.
Thank you, Adesh. Those were fantastic clinical pearls. And before we go on to the didactic session portion of our session, I'd just like to thank both you and Marcus for being just such phenomenal actors. You really brought the case alive, and we greatly appreciate your participation in this. So next, we'd like to talk a little bit about the climate change angle for this case and the impacts of climate change on the hydrologic cycle and waterborne disease as was relevant to this case. We know that extreme events pose significant risks to life, property, and the economy in the Caribbean, and some extreme events such as flooding and droughts are projected to increase in frequency and intensity. We also know that the Caribbean has a particular exposure and vulnerability to extreme weather events driven by climate change. A high concentration of population and critical infrastructure in low-lying coastal areas increases vulnerability to sea level rise and storm surge and magnifies the effects of coastal flooding and beach erosion. increasing hurricane intensity and associated rainfall are expected to affect human health and well-being in the Caribbean. The health impacts across Caribbean small island developing states span a large range, including direct health impacts like physical injury from wind and water during hurricane passage and during post-event rescue and cleanup efforts, and indirect impacts like heat-related injury due to loss of access to air conditioning and fans, inability to manage chronic disease due to loss of access to electrical power or medical services, and increased exposure to vector-borne diseases and diseases from contaminated water. Mental health impacts are also notable, as most survivors experience a high degree of psychological trauma during and after hurricane events. Specific to our case today, flood disasters have a significant impact on chronic health conditions, with medication noncompliance due to non-availability, difficulties with access to health services, and the physical workload associated with cleanup and reconstruction being significant problems after a disaster like the one described in this case. So what are the forces driving more extreme weather events in the Caribbean? We tend to focus on land surface temperatures because that's where we live. However, it's critical to remember the climate system includes the oceans in addition to the atmosphere. And as it turns out, and as illustrated in the figure presented in this slide, a tremendous amount of heat energy has been absorbed by the sea. But the ocean's capacity for storing heat is not unlimited. The warmer ocean leads to more evaporation, meaning more energy available to drive weather patterns and very likely more intense rainfall. When it comes to sea level rise, these are the facts. Sea level has risen 8 to 9 inches or 21, 24 centimeters since 1880, and the rate of sea level rise is accelerating. The rising water level is mostly due to a combination of meltwater from glaciers and ice sheets and thermal expansion of seawater as it warms. So what's going on with the hydrologic cycle, or the cycle that involves the continuous circulation of water in the Earth atmosphere system and climate change? Well, higher temperatures mean there's more evaporation from the land and sea into the atmosphere. And as air gets warmer, it can hold more water vapor. This can lead to more intense rainstorms. In turn, more intense rainstorms increase the risk of flooding. And while we would think that this would help with drought, much of the water runs off into rivers and streams, doing little to dampen the soil. And this, combined with the increased temperature expected from climate change, actually can increase the risk of drought. So let's shift gears here and talk a little bit about waterborne diseases. So what is a waterborne disease? Waterborne disease is a disease that's spread by the consumption of contaminated water, and that's the definition from the World Health Organization. It includes pathogens from a wide range of taxa, including viruses, bacteria, protozoa, and helminths. And statistics show us from the US that 7.15 million people domestically acquired waterborne illnesses in the US on an annual basis. And it's responsible for over 1.5 million deaths globally as of 2012. 50% of that burden is in low and middle income countries. And by and large, it's attributable to unsafe water supply and inadequate sanitation and lack of hygiene. Now let's connect what we know about the changes in the hydrologic cycle due to climate change and waterborne disease. Flooding leads to increased exposure to groundwater and overflowing sewage systems. These conditions can expand vector breeding grounds, increasing the contact between populations and vectors, and the resultant increase in disease cases. This data from the United States shows us that a large majority of waterborne disease outbreaks can be attributed to heavy precipitation events. The risk of gastroenteritis after flooding is highest in areas with poor hygiene or inadequate supply of clean drinking water, though outbreaks of diarrheal diseases are common even in resource-rich areas, particularly if the integrity of sewage systems is compromised. This is a slide that briefly reviews the life cycle and transmission of leptospirosis, the pathogen involved in our case today. It's important to note that while lepto is commonly associated with a rodent host, just about any vertebrate species in the Caribbean can serve as a host, including dogs, cats, cattle, pigs, horses, and others. And also, it's important to note that while flooding is an important risk factor for the transmission of leptospirosis, lepto transmission can occur during drought conditions as well. So as Adesh was mentioning, taking a good environmental history is critical. And now let's shift gears to the other major element of this case, mental health. We know that climate change and related disasters cause anxiety-related responses, as well as chronic and severe mental health disorders. Flooding and prolonged droughts have been associated with elevated levels of anxiety, depression, and PTSD disorders. The trauma and losses from a disaster, such as losing a home or job and being disconnected from neighborhood and community, can contribute to depression and anxiety, among other mental health conditions. And finally, I'd like to review some tips on how to take an environmental history, which was, once again, such a critical part and really a crux to us identifying the infectious disease piece of the case presented today. So how do we take an environmental history? This is a review from our last session. These three key questions can be enormously helpful in elucidating how your patient's health may be impacted by climate change-driven hazards. And they include, what do you do for a living? Do you work with any chemicals at home or in the workplace? Are you ever exposed to potential hazards in your home, community, or workplace? Do you think any of your problems today are caused by exposures in your home, community, or workplace? I would hazard to say that using these questions, we could have gotten to a similar answer as Adesh did with the case that was presented today involving leptospirosis. That's the end of our session. And again, I'd like to take a moment to thank our actors. And thank you again for tuning in, and we'll see you next time at our next clinical skills session. Thank you very much. Take care.